1300. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, 1300. Did you know live Senate video is now available at youtube.com/@Senate of Virginia. Senate Committee Room, 1300. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, 1300.
.30, so we're going to go ahead and get started. Do we need to take the roll? Oh, okay, we've got a quorum. We've got, yeah.
An electronically proxy, right? Just got my proxy. See ya.
Okay, thanks. Yep. Okay, we've got 4 bills, and then we're going to take up the budget amendment. We're going to have it. Staff's going to review the budget amendments, and so Senator Locke's not on the subcommittee. You've got 3 of the 4 bills. Senator Vola's got the 4th. So you've got 1 bill. So Senator Locke.
Whatever you decide.
Okay, let Senator Locke go first. Okay. Which bill would you like to take up first?
Whichever one you want to kill first.
I'm not really in the killing mood. I'm not in the killing mood.
Okay, let's take up, I think you have 758.
Got that one. Yes, ma'am. That's your first one.
Okay. This has to do with remote patient monitoring for pregnant and postpartum patients. And basically, addresses advances in medicine and healthcare services. Maternal mortality has increased 144% in the last decade. In communities of color and in rural Virginia, women are at a higher risk for a poor outcome in pregnancy. So this legislation will allow providers to appropriately determine whether patients are high risk and need additional care and services. So SB 758 expands remote patient monitoring to all pregnant and postpartum women on Medicaid.
Okay, and this bill was heard in Education and Health and reported and re-referred there, so we don't need a public hearing. Does everybody understand the bill? It's postpartum monitoring, patient monitoring.
Mr. Chair,
Senator Fabola.
I know it has an impact, but this is really important. Maternal health has been a big priority of our efforts for a couple years, so I'm going to move that we report the bill. Second.
Okay, the motion is we're going to recommend that the bill be reported, unless there's another motion. I'll take a vote. All in favor of reporting Senate Bill 758, say aye. Aye. Any opposed? Okay. What's your next bill?
Senate Bill 831.
Okay.
This has to do with presumptive eligibility. This proposed legislation would direct DMAS to seek federal authority to implement presumptive eligibility for pregnant individuals. Once federal approval is provided, DMAS is allowed to authorize qualified entities to make determination of presumptive eligibility for pregnant individuals, including healthcare providers, community-based organization, elementary or secondary schools, or any other entity that the department determines to be capable of making such determinations.
This is also a bill that came through Education and Health.
I guess, Chairman.
Senator Fabola.
Again, this is part of a safety net we're trying to create in the area of maternal health. And I know that we have an impact here, but as you know, we're drawing down federal money too, Medicaid dollars. So I'm going to move that we report the bill. Second.
Okay, got a motion and a second.
Mr. Chairman,
Senator Reeves.
I just have a question for Senator Locke, if it's okay. I'm reading the second bullet point. It just says any individual deemed ineligible would need to be repaid, and it's unlikely that any recoup of state dollars would occur.
Where are you, Senator?
In our notes, it just says the cost of these claims would initially be covered with state and federal dollars. However, the federal funding associated with any individual deemed ineligible would need to be repaid, and it's unlikely that any recoup of state dollars, since they're probably indigent anyway. I guess maybe staff would know, is that they're just estimating we're not going to get our money back for those that are ineligible?
So, Mr. Chair, Senator Reeves, so the one thing I do know is actually in working with DPP and DMAS is that the fiscal impact statement had an erroneous assumption, which was the repayment of people who were deemed to be ineligible. The way that the feds kind of work presumptive eligibility is, if you determine it in good faith and your error rates are like within certain norms, then they don't recoup the money. So there should be a new fiscal impact statement that comes out that reduces the cost estimate, but essentially you won't have to repay any back as long as you follow all the federal rules about properly training providers and ensuring that their error rates are low.
Okay.
I will be honest, this, as with the current fiscal impact, the larger impact is from the state, from the general fund, rather than from federal drawdown. So what I would prefer a motion to pass the bill by for the day and try to figure this out in the budget. Does that make sense?
Yeah.
That's fine.
Mr. Chairman, I understand, and I will withdraw my motion. We can pass it by and maybe work the numbers a little bit.
That's fine.
Okay.
All in favor of passing the bill by for the day?
Aye.
Okay, Senator Locke, you've got another bill.
Okay, my last bill is Senate Bill 833, which deals with the Hampton Local Health Department. And I know that we're going to be working on some additional language with regard to this. Currently, the city of Hampton receives services from what is known as the Hampton and Peninsula Health District. And this is a mega district that includes health districts serving residents from the cities of Hampton, Newport News, Poquoson, Williamsburg, and the counties of James City and York. And during and post-pandemic, the complications and challenges of such a large mega district became evident, with localities having varying needs and challenges. And this was recently highlighted in reporting done by the Joint Subcommittee to study the pandemic response and preparedness. The total resident population of these 6 jurisdictions is over 500,000 people. Residents reside in urban, suburban, and rural environments. Over 50,000 students attend 77 public schools and 5 independent school districts. Hampton has 137,000 residents, nearly 30% of the population of this mega district. And we have totally different socioeconomic diversity and demographics for these populations. So it is important that the city of Hampton have its own health jurisdiction.
It's my understanding that they used to have their own health district.
Yes.
And it was changed during the McAuliffe administration.
Right.
And we're going to amend this bill to require that the cost be paid by the city of Hampton.
Joint payment between the city of Hampton and the Commonwealth.
What? Okay, I want to understand how we're going to amend the bill.
So, Mr. Chairman, I think that was one of the discussions, was that it was sort of late breaking, that maybe to move the bill forward, we would have, I don't know, probably like an enactment clause or something. Yeah, or make it, yeah, or just more language, because it's a Section 1 bill, to basically specify, to make this happen, that initially the city of Hampton would cover the cost to establish the additional people they need to lead it.
Correct.
Yeah.
Okay, well, then in theory, do we understand the amendment? Basically, the city of Hampton's going to front the money to establish a leadership team. Do I have a motion to adopt that? No,
Not
now.
delayed.
Just that Hampton's going to front the money to establish a leadership team.
Because the city has the facility.
That's right, the facility's there.
Yeah.
So motion has been seconded to adopt the amendment. Okay. All in favor? Aye. Okay. Do I have a motion that we recommend reporting the bill? And a second, all in favor of reporting the bill? Aye. Okay. Thank you, Senator Locke.
Thank you very much.
Senator Favola, you've got a bill.
I do. Mr. Chair, I move that we adopt the line amendments to my bill, Senate Bill 773.
What are the line amendments? What do they do?
I can tell you, for the most part, the line amendments actually deal with lines 57, 58, 59, and 60. It came to our attention that we didn't really articulate clearly who was eligible for the vouchers. So the line amendment picks that up. We were not clear, and program administrators pointed that out to us. And then on line 62, we deleted part of line 61 through 62 and made it clear that the housing authorities and local departments of social services need to collaborate, but they don't need to work directly with the Department of Housing and Urban Development.
Okay, then a motion and a second to adopt those amendments. All in favor, say aye.
Aye.
And this bill really is to assist
This is-
older foster kids
Who are-
aging out of the process.
That's right.
With housing.
That's correct. And it's a program that we have not participated in the past. So this authorizes the Department of Social Services to enter into a memorandum of understanding with first with the federal government, the U.S. Department of Housing and Urban Development, so they can facilitate partnerships for the localities to draw down vouchers.
Senator Reeves.
Wasn't it 22? Now it's 24, the safety net. At one point, I thought we were at 22 years of age.
Our Fostering Futures is still at 21. It protects children from the ages of 18 to 20, but the federal government is moving some of the programs now to help kids who are up to 24.
So
That's
maybe we
right.
ought to look at that too, maybe next year.
Yeah, that would be great. It does, it will have a fiscal cost.
Yeah,
Well, the fiscal impact of this bill is none for this fiscal year, but for 26 and 27, it's almost $500,000.
right.
But I do want to say, Mr. Chairman, that these youth are most at risk for homelessness. I mean, they don't have a family. There's not intergenerational wealth. They're exiting the system frequently sooner than they should. They don't agree to be in the Fostering Futures, and they.
Okay, there's a motion and a second to recommend reporting the bill. All in favor, say aye.
Aye.
Okay, opposed? The bill's recommended for reporting, and now staff is going to review the budget requests from the governor and I think from the members.
So y'all saw this, we did the same presentation sort of for the overall committee. And so in this presentation, we're just going to kind of go through that again. But since it's the subcommittee, if y'all have more questions, we'll go into just a little bit more detail. So the quick overview, you can just see the investments of over 857 million general fund and 2.3 billion non-general fund is added in the introduced budget. The largest cost being the growth in the Medicaid program, and the forecast for that was 632 million. And then, of course, the Children's Services Act, 105 million was the next largest increase.
Am I wrong, Mike, that this is the largest mid-budget adjustment we've ever had?
So for Medicaid, yes, that I can remember, yes.
Never had an adjustment this big.
No, the last time was probably the 2018, 2020 biennium, which was related to the rollout of the new managed care program. That year, the amended budget was like 463 million. But that was really specifically due to one issue, which was the rates for that program. Whereas in this case, the 632 million, which if you remember, you already set aside a $95 million reserve that reduced that amount. That this basically shows growth in many areas of Medicaid. So it's more of an overall growth trend.
And I will point out that our staff, you all more correctly, you got closer to what the overrun was going to be, and we were stuck at 95 because that's what we could get from the House. Is that right?
Mr. Chairman, yes, that's what kind of came out of conference, I think, in just the final negotiations and how the money worked out. We couldn't do 150, we did 95, but yeah, and the final numbers for fiscal year 24 were closer to the $150 million number because they had to postpone payments into this fiscal year. And then here, the children's health insurance programs, which are also forecast, they've actually, the enrollment's been increasing as well as the rates that, the managed care rates for that. And then, of course, this we'll talk about is the largest proposal. It really is policy proposals, the 35.2 million for the special conservators of the peace in private hospitals, which is the DBHS initiative to relieve law enforcement's responsibility when it comes to custody for ECOs and TDOs. So I'll start off with the DMAS. I won't talk about the forecast. The healthcare fund adjustment, if you remember, that supports the state match for Medicaid, and so that's adjusted every year based upon the latest revenue estimates. Involuntary medical commitments, this is where DMAS actually pays for the costs of those, the medical costs of those commitments, and that's down slightly. You can see about 1.2 million over the biennium is for the implementation of the seriously mentally ill waiver. So this is one in which you all had directed DMAS to actually apply for that waiver. And then, of course, this is sort of the next start to implement it. And, of course, one of the things that this will do is it kind of coincides with the idea of trying to increase the revenue to support crisis receiving centers that the state has invested a lot in recent years. Pretty much any facility with over 16 beds. There's $1 million set aside for a proposal to create a reserve for the future cost of Medicaid initiatives. It's attempting to kind of get to the idea that can you set aside money, most of these initiatives, once fully implemented, initially they cost less because you don't see the full cost of full implementation. And the idea is basically just try to reserve kind of the estimated future cost of that now, so you kind of correct the base budget going forward. But and so the $1 million is tied to 4 of the initiatives that the governor had proposed. There's just less than $1 million to fund DD waiver and other administrative costs. So this is really more tied to the growth in the waiver slots that were the 3,440 waiver slots that were funded over the biennium. And then there's the a lot of these are actually very administrative. There were some new federal eligibility and processing rules from CMS, so there's money for DMAS to comply with that. There's the coverage for pre-release of justice-involved youth. That's also a CMS requirement, and that's intended, of course, to prepare youth for reentry to make sure that their services are set up related to Medicaid. And then there's basically maintaining managed care for children in residential facilities. So in a psychiatric residential treatment facility now, the way it actually is designed, if you go into it, they completely pull you out of managed care and you're in fee-for-service. So this would keep them for the non-residential services, technically would keep those services in managed care. And then there's about $250,000 the first year for the Virginia Task Force on Primary Care to continue its work related to primary care. And then the last one is coverage for long-acting injectables for mental illness. This is actually something that you all had adopted last year, but it didn't make it into the final budget. But essentially, before you basically leave the ER or whatever setting you're in, they can give you that long-acting injectable that can work for up to 30 days before you're connected to community services. So turning to Department of Health and Developmental Services. So the biggest one is the Special Conservators of the Peace for private hospitals. So you know that this is something that you all have been working in for a number of years now. The General Assembly had funded basically the whole transportation contract, which they do with Allied, and the idea there was that these individuals, that they would actually transport them as opposed to law enforcement. And that's had some, I think, limited success, and I think that's really the issue, is that they're proposing kind of a different iteration of this now. They are doing this kind of in Southwest, and what it's doing is using this part of the code where there's these special conservators of the peace that basically have certain powers, and that they would basically take custody primarily when the individual is waiting in the hospital, whether it's the ER because they're under an ECO or they're waiting for a bid because they've been determined that they need a TDO.
Mr. Chairman, I will just note very quickly that these special conservators, according to Commissioner Smith, will be well-trained. They'll be trained in de-escalation techniques and using the least restrictive measures to control the patient or to ensure the patient's safety and the safety of others. So there's some special advantages to this program, as I understand it, and I do know there is a cost, but
It's based on a program that they pilot project in Southwest Virginia.
and it has worked.
It's worked.
Yeah, it's worked. So
The next one is just $4.6 million. So this is tied to basically the administration, for the most part, of DD waiver services and quality assurance. The $4.6 million, I think, is heavily tied to the permanent injunction, which you all are aware that was just recently signed off by the judge. So the permanent injunction, I won't go into great detail, lasts for the next 7 years. It's really intended to focus on those areas where the state still needed to achieve some level of compliance. So this money is sort of tied to building that capacity and meeting those requirements. There's $3.3 million for pharmaceutical costs of state facilities. Their costs go up just like everyone else's. You'll see over the last few years, there have been salary alignments for different employees of the state facilities, and this is kind of the final piece of it, that is for the trades positions. In the past, direct care staff and other have been funded. So this is sort of all the tradespeople that kind of maintain the facilities. Part C, early intervention, this is the non-Medicaid piece, and of course that grows. This funds that growth. Then there's $1.5 million to sustain the adult psychiatric access line. So you all are aware of VMAP, which is the children's version that you all have funded in recent years. That's where it provides pediatricians the ability to access somebody with expertise when it comes to mental illness, so they can actually treat the child in a primary care setting. So this is, it started with a federal grant, and this is to kind of continue it. The Medical Society of Virginia was the one that DBHCS was working with to kind of operate this. So this kind of just continues it as is. You see there's member budget amendments to kind of expand it statewide. But it's just kind of the same version of the children for adults. Yeah. And then you can see additional administrative costs of the DD waiver slots. That $1.2 million is more tied to the actual conducting service authorizations, the routine administration of the waiver slots. $1.2 million to fund the crisis co-response programs. So as you know, the legislation requires, in all the localities for which it is required, that they have to be in place by 2028. The $1.2 million you'll see in the member amendments. This is actually, while this is additional funding, it doesn't necessarily meet and follow what the statute requires. So that's a discussion point for the subcommittee to figure out, to provide more funding to the localities to kind of meet that state mandate. Support the Youth Mental Health Matters Initiative. So this is sort of initiative kind of to try to reach out to youth, to talk about the, it could even be the dangers of social media and things like that would otherwise affect their mental health. There's additional money for additional forensic evaluators, and as you know, of course, the state hospitals, the forensic population has been very high for some time, and this actually helps to sort of get them to a discharge situation sooner than later. There's about $800,000 for youth peer support specialists, so this is kind of trying to build the pipeline of peer specialists in the workforce. And then lastly, there's some additional money for licensing positions and an information security position at DBHCS. So with that, I will turn it over to Sydney to talk about the next couple agencies.
Thank you, Mr. Chair. So initially, there's about $8 million over the biennium to enhance child protective services. Basically, this is implementing the Office of the State Inspector General recommendations, and a large part of this is going to local departments to enhance and help with caseloads. There's $7.3 million in the second year for the increased contract costs for income verification with Equifax. There is some movement on this, and they have to renew the contract by the end of this month. Skipping down to funding the administrative cost of child support enforcement, there's about $900,000 over the biennium. There's $800,000 to enhance electronic identity validation efforts. There's also funding to modernize the 211 system, which helps connect people to social services. There's also about $300,000 for additional positions to help increase the increased procurement workload. A lot of this is to help with the large number of pass-throughs that DSS has to do to other local services. And then there's just the adjustment for the child welfare forecast. Going over to the Department of Health, Governor's budget has put in $2.5 million in the second year for the perinatal health hub pilot programs. I believe this would do 2 sites. There's about $1.8 million to help comply with drinking water regulations. There's $1 million to support the Division of Disease Prevention, which is replacing federal funding that was lost during a federal budget adjustment. There's an additional $1 million for community health workers. In addition to that, it adds doulas to the funding that we passed last year. There's about $900,000 for home care organization licensure to help catch up on the HCO licensing. There's a huge backlog on those examinations. There's about $800,000 to support IT security and audits and investigations. There's $500,000 for rent increases at local health departments. $500,000 to get the electronic health record system off the ground. There's $450,000 in the second year to establish a large animal veterinary loan repayment program. There is about $300,000 to establish intermediate disciplinary actions at care facilities, and this is also tied to legislation that I believe will be coming up in Ed and Health that has not been heard yet. And then there is also about 200,000 over the biennium for the implementation of rainwater harvesting system regulations, and this is tied to legislation that was passed in 2023. I'll turn it back to Mike.
So, Mr. Chairman, just coming to the other remaining HHR agencies, which there's not a lot. The Secretary's office had two items. One is sort of to develop a plan where you would create a program that would enhance the collegiate experience for developmental disability individuals. So there's 100,000 for that. And then the other one was kind of a marketing campaign to focus on maternal health warning signs. So that was about $500,000. You'll see here, just as where the CSA forecast is noted, there's one additional position added for administrative costs at CSA. And the disability agencies, probably the largest increase is just really more of a administrative thing. DARS basically does the back office functions of all the other smaller disability agencies, and so they pay them for that service, and so there's money to reflect the fact that their costs have gone up in that administration. There's also about $375,000 for blind and vision impaired for their rehabilitation, teaching, and independent living program. And then at deaf and hard of hearing, $50,000 to study the transition, the digital transition for the Virginia Relay Center. And the last item here before we go into member budget amendments is just language-only items. So one of the things that I'm sure you've heard about is for CSA is this proposal to limit the state's share of the growth to 2.5% in fiscal year 26. The CSA forecast does not really reflect any impact from that. And this is actually something you might remember we did a few years ago where there was a limit of about 2%. I think we did it for at least 1, maybe 2 years in a row. And but I'm sure you've heard a lot about it. So, you know, of course, the issue with that is, if you probably hear from the local governments, is that regardless of what the state caps its share, the expectation is that they still have to pay the remaining share to the private day school. So, but again, like I said, that's one attempt to try to control state cost. I would note for the Medicaid graduate medical education payments, that program that we have, there's a change. It won't affect the next biennium, but it increases the payment to the hospitals to $150,000 annually for just psychiatric and OBGYN residencies. There's a change in the Medicaid reimbursement methodology for adult day health care from a daily rate to an hourly rate. There's also some language related to DBHS and making grants to recovery residences certified by the department. So the current money in the budget is actually tied only to the residences that are members of the Virginia Association of Recovery Residences, but there are ones that are outside that, and that language actually expands it to any of them. Then there's also, if you remember, school-based mental health services. Last year, there was this $15 million pot of money that basically was to provide additional funds to school divisions for mental health services. Last year, the General Assembly actually changed it to basically be more focused on funding school-based clinics. So this language sort of like kind of takes it back into the middle that you could fund either. That's what it's proposing to do. And then within the Department for Aging and Rehabilitative Services, there's language. The Long-Term Employment Support Services and Extended Employment Services programs are two different programs that basically deal with employment services. It funds employment services organizations to provide jobs to people with, and support people with disabilities. This just kind of combines the program into two because it doesn't really make sense anymore to keep them separate. And the last thing I noted, it's in the Part 4 of the budget, but is, you know, the annual basically changing of the language that relates to the restrictions on any expenditure funding the state budget related to abortion services.
Any questions from Mike or Sydney about what's in the proposed budget? Okay. We'll move
Okay.
on to member amendments.
Yep, gonna pull it up. Oh, did you want to pull up on the screen? So and you should have the list in your books as well. So we're not going to go line by line because we'll be here all day. But as usual, there are a lot of amendments in Health and Human Resources. I believe there was somewhere in the neighborhood, I don't know if this adds it up, but probably around 180 or so, which seemed higher than normal. So I'll start off just like in CSA, you can see they're all pretty much the same to eliminate that state cap that I just talked about. So no surprise there. What I would do is actually I'll jump around. That way I don't have to, me and Cindy don't have to go back and forth. So we're going to skip BDH for now and go to Department of Health Professions, it's lines 30 and 31. That's just related to bills, so nothing to talk about there. So looking at DMAS on page 2, many of these you've seen before, different initiatives that get proposed. The largest dollar amounts when you look through, of course, DMAS are going to be things for where provider rates are to be increased. So it's everything from personal care rate increase for home care workers. You know, there's one of that's over $138 million. There's increased rates for applied or requests for applied behavior analysis, as well as DD waiver services, and in the smaller services as well. I will note, when it comes to certain proposals like language, there's a couple amendment items. One of them is by Senator Deeds as well, that deals with the Medicaid trigger language, which is certainly something that the subcommittee will have to discuss as well.
And Mike, I realize we can't do that because we don't have the money to figure that out. But we have to be prepared to be on the balls of our feet and react if we have a problem at the federal level.
Right. Yeah, and Mr. Chairman, I think a lot of the concern is because it's designed to be automatic. In my thought process is basically like, if Congress does take some action that impacts that, it should be somewhat prospective. The question is really how much time do states have to think about it and to respond? But anything that's dramatic, of course, 41 states have expanded, so it's a significant cost if you went to the normal match rate. For Virginia, it would in the current year, be like well over $2.5 billion in the general fund. So,
To go from 90% to the 50%.
to the normal state match rate.
Wow.
It would be over that. So really, I think the issue there is that, if you had something that dramatic occur, I mean, I don't see how that the General Assembly could not be called into special session to do something like that. But at this point, we'll just have to monitor what the federal government what Congress is doing and respond there. And the other thing too is if you get outside of session, the Joint Subcommittee for HH Oversight, that was one of its, if you remember the last time, years ago when they were, Congress was looking at changing the Affordable Care Act. That was one of the reasons the Joint Subcommittee was created, was to evaluate federal changes.
And the joint subcommittee met this past year a couple of times, I guess. It didn't meet the year before,
Right,
but we've reignited that committee.
right. So moving on through DMAS, like I said, if there's anything else to note. Like I said, there's a variety of things that we'll continue to go over as we talk about the budget. So moving to DBHCS, which should be starting on line 84. There you have everything from increase the number of licensed therapists. Some of these are bills, which I won't talk about. On line 91, the adult psychiatric access line, that $4.5 million is to make that program statewide, which we talked about the piece in the introduced budget. And you can see just a variety of other things, as well as a couple amendments related to the co-response funding as well. And the other thing to note too here on line 105, and it's a capital issue, but it's one even for the subcommittee to think about, is what to do with Hiram Davis and the individuals that are there. The department, of course, is going through their process, which does take a couple years to potentially close it. Certainly Hiram does have a lot of issues. And so the idea is that Southeastern Virginia Training Center, which is the last training center that the state has, is that you could convert some of the houses that are there to a point where they could take care of some of the individuals with the greatest need at Hiram Davis. And some of those individuals are ones that you're probably very familiar with because they're the individuals that were transitioned from Central Virginia Training Center outside Lynchburg when they closed the skilled nursing unit there and they were moved to Hiram Davis. And those are the individuals that have the greatest needs of anyone in the system.
How many patients are at Hiram Davis now?
I think the most recent thing I saw was somewhere around 37.
At 37, and the cost of renovation down there is like tens of millions of dollars. Is that correct?
Yeah, I think it was like the initial proposal last year, something was like over 50 million.
So their idea is to renovate some houses or some housing at the Southeast Virginia site and
Right.
move the patients down there. Now, do we have any more intelligence on what's coming from the other side?
Mr. Chairman, nothing recent. I mean, I think
Well,
it's,
my understanding was that they were going to try to have an immediate closure, which would kind of bypass the statutory process.
yeah, I think part of the thinking is that maybe that it is, because of some of the issues at Hiram Davis, that it might be more urgent to try to move them more quickly. One of the, I guess the issues is going to be you would have to renovate Southeastern in order to have space for the, to have the capabilities to serve those people.
That's going to take much of the 2-year period of time that the statutory process would call for.
It's possible, yeah. And then moving to aging and rehabilitative services, there were only a few amendments. Centers for Independent Living, area agencies and aging, all ones that you'll typically, in brain injury, ones that y'all typically see every year. And so with that, I'll let Sydney come up and she'll walk you back through the Department of Health and Department of Social Services.
All right. Thank you, Mr. Chair. So there are several amendments dealing with the healthcare workforce, including the behavioral health acceleration and the nursing education acceleration, physician loan repayment, and LPN to RN scholarships. There's also several water projects, including Senator Reeves' work in Greene County, and then there's also in Orange County, and then some other water treatment projects. There's more money for the federally qualified health centers, and then there are implementing the JLARC recommendations from for VDH. And then there's also replacing the abortion care coverage for fetal anomalies that the governor's budget took out. That's really the Department of Health. I'll skip ahead to the Department of Social Services. So here, a large part of this is for additional pass-throughs. There's also funding and budget amendments in here to increase kinship care and establish MOUs for kinship care in surrounding states. There's also additional funding for child advocacy centers and community action agencies. There's also an attempt to transition EBT cards to chip cards and fraud, and to really put a damper on that. And then there is also a SNAP increase for the elderly, and a DSS peer support helpline and community resilience model to help DSS staff. And then there's a couple budget amendments dealing with the auxiliary grant funding for assisted living facilities. That's really it for DSS and VDH. Yes.
That particular member has their own
Well,
mint.
great niche. But it's only focused on really good, important things.
I got that. I got that. So we're done with the member amendments? Okay, are there any questions does anybody else have any questions? Well, we will rise. Okay. And
The Senate of Virginia, Richmond, Virginia.